we're going to do questions from all categories tonight. I thought that that would be like a nice way to finish out the class. So hopefully you guys are good with that. And we'll follow the same pattern, which is where we discuss the answer. If you guys get it wrong, all you have to do is just say, wait, I don't understand. Why is it that one rather than this one? What's the explanation? And if we need to go deeper into the concept for something, we can do that, obviously. So before we start, let me just see if there's a charging cord for this thing here. Nope, there's not. Okay. Okay. Here we go. So during the licensing process, some states will require a massage therapist to pass this type of exam, which ensures the massage therapist understands the laws regulating their profession. This type of exam, is it the state board exam that makes sure you understand the laws regulating your profession? Is it the jurisprudence exam, the exempt exam, or the constitutional exam?
State board.
I'm glad you spoke up. Thank you. The correct answer is the jurisprudence exam. So the state board exam is a comprehensive exam covering all topics related to massage therapy. All topics. So that's like clinical topics, legal topics. But the jurisprudence exam covers rules and regulations, law, right? For massage therapy in that state. Not all states require a jurisprudence exam, and they do administer the exam differently, state to state. This exam is given to ensure therapists understand this information and therefore are less likely to break the law while practicing. So you have, yeah, okay, we'll go into all that. You guys can check out the recording if you need to. All right, a client comes to you with difficulty bending forward toward the floor from the waist. What plane of movement is this patient having difficulty with? Is it the rotational plane, the transverse plane, the frontal plane, or the sagittal plane?
Transverse.
Say again, someone. Sade, I heard you. Was there someone else speaking?
I think Larissa.
Larissa,
Yes.
did you say something?
What did I
Which one
say again?
do you think it is?
I said the frontal plane.
Frontal plane. Okay. The correct answer is the sagittal plane. All right. Yes, it's a good idea to review our planes because actually let's try without looking at the, maybe you guys will remember enough. Okay. So the plane is decided for this. The plane is decided based on the direction of the actual plane, right? So the sagittal plane divides the body into left and right. Actually, it's left and right. Do we agree on that? You guys remember that?
Yes.
Okay, so it divides it into left and right. So if I move this way, I'm actually moving along the plane, right? So imagine this plane is coming this way, dividing my body into left and right, right? And I'm moving along that plane. Got it? So if you were visualizing or drawing or in some other way, like displaying X-ray results, for example, if you were like visualizing the body up on a whiteboard or a computer screen or a projector screen or something, the sagittal purpose of the sagittal plane would be to divide the body into right and left. Okay, but in terms of movement, not visualization, in terms of movement, moving along the plane would have the person going forward and back into flexion and extension if you're moving from the head.
Yeah, I would have definitely still got that wrong because I would think that it was transverse because like it says the waist.
Yes, I would think that too. I would think that too. But actually, purpose of the transverse plane in movement is not just the purpose of the transverse plane is more twisting, right?
Okay.
So the two ways to move through the transverse plane, transverse goes this way, right?
Right.
So first of all, if you're visualizing the body, transverse plane splits it into upper and lower. So imagine I open up a space in my body. Imagine my body is made out of like a cartoon illustration, whatever, and I open it up and you're looking inside and there's the organs and the bones and the muscles on the bottom and the organs and the bones and the muscles on the top, right? So it would be the top and the bottom. But the plane itself, if I were to move along the transverse plane, the movement would look more like this.
Okay.
See? Let's see. I could just permanently hide that thing. Is this still confusing to you guys? Do you guys want to see a little bit more about the planes?
I mean, no, I get it.
Yeah.
Oh.
Yeah.
Sorry.
Okay.
Yeah.
That's a yeah. Don't be sorry. This is your time, and we should be doing it in a way that helps you guys. Man, the stuff that pops up in YouTube, look at this nonsense. Like, what is all that stuff? Anyway, I promise I don't watch like whatever that is. Beaver videos. I don't watch pet beavers. I've never seen a pet beaver. Anyway, or wooks. I don't know what that is. Okay, so let's look at movement planes of the body. Planes of motion.
Sagittal plane is a vertical plane cutting the body into left and right halves. So any forward and backward movement parallel to this plane occurs in the sagittal plane. Movement such as flexion and extension will occur in the sagittal plane. As you can see with this lunge movement that Molly is demonstrating, her body is moving front to back.
So they haven't showed the flexion movement through that plane yet, but it would be bending forward at the waist or, bending forward through the spine. This is also sagittal plane movement. All right, and then next one is
Vertical plane that passes through the body, dividing it into anterior and posterior halves. Any lateral or side movement.
Which one is that? Which plane is that? The plane that passes through the left and right parts of the body, dividing it into the front and back. Sagittal goes straight. Sagittal divides it into left and right. And this plane goes from left to right, dividing it into front and back.
Is it? I think the other name for it is coronal, or I can't.
If I'm not mistaken, it's it may be the coronal plane, but I think it's the frontal plane. Let's listen.
Into left and right halves. The frontal plane is a vertical plane that passes through the body, dividing it into anterior and posterior halves.
Frontal plane, which is left and right. We'll look at a summary of those in a minute.
Any lateral or side movement, moving towards or away from the midline, will be on the frontal plane. So movements such as adduction and abduction, or elevation and depression at the scapula, will occur on the frontal plane.
Okay, so I was incorrect when I described it. I was describing frontal movement when I described transverse. I'm sorry about that. So this is frontal movement. You can see that she's moving in parallel with the plane. She's actually moving her arms and legs along the plane. But if she were to sidestep, that also would be frontal movement. Side bending. Let's look at the last one. And the name of this plane? Transverse.
This is a horizontal plane that divides the body or parts of the body into top and bottom halves. Anytime we rotate a joint, it occurs in the transverse plane. So movements such as rotation, pronation, and supination all occur in the transverse plane. For example, you can see that Molly is demonstrating an external and internal rotation of the humerus. Since this rotation at the shoulder joint is pivoting, it indicates it's on the transverse plane. A movement also like this torso rotation that Molly is demonstrating, the movement is running parallel to that invisible plane, which is cutting the body in half. Keep in mind that while it's helpful to define the three principal planes, many human movements do not occur in a single plane and usually cross two or more.
All right, let's look at our actual. See if we can do this without. Where were we last time? We were in the body systems. Did we put the planes? Do you guys remember? Did we do planes of movement in the muscular system?
I don't recall doing that.
No, we didn't do that. Oh, you don't remember doing that at all?
No.
Huh, okay. I do remember presenting those to you guys recently.
I remember talking about it, but as far as the movements,
Yeah.
I don't remember, but I don't have the best memory either. So if someone else can maybe confirm that.
We had a drawing of the planes, and there was just a way of organizing. Here it goes. There's a way of organizing. Okay, so so there's the frontal plane, the sagittal plane, and the transverse in alphabetical order, right? So frontal plane, transverse plane, sagittal plane. So this is the mid-sagittal or median, and then parasagittal, right? So frontal, sagittal, transverse. Frontal, sagittal, and transverse in alphabetical order. And that corresponds to front and back for frontal, left and right for sagittal, up and down for top and bottom for transverse. So my suggestion was that during the test, you write them out for yourselves. So frontal, sagittal, transverse, alphabetical order, front and back, left and right, and then top and bottom or up and down for transverse, right? So you do the correlations. Do you guys know what I mean when I say write them out?
No.
Can I have a yes if you know?
No.
You don't? Okay. Suppose annoying doc. So when you memorize something, like let's say you guys remember do you guys remember the names of the hormones from the hypothalamus and pituitary? You guys remember flat peg? Where we had like follicle stimulating hormone, luteinizing hormone, right? Adrenocorticotropic corticotropic hormone. You guys remember those?
Yes.
So that's a mnemonic, right? Where you have like flat peg, and then you list all the hormones out. So when you have something like a mnemonic, or you have something listed in order in such a way that you can understand it, like here we have frontal, and then we have sagittal, and then we have transverse. It's a good idea for you to write those things out at the beginning of your test or when you encounter them. So let's say you've done a few questions and a question comes up on the planes or the planes of movement. At that point, it's a good idea for you to write these out. And you have to remember alphabetical order as compared to some mnemonic like flat peg. You have to remember alphabetical order. Let me see if I'm spelling this. I guess I am spelling it right. It's driving me crazy that it says it's not correct. But you have to remember alphabetical order and then write them out in alphabetical order, and then you're good. So frontal corresponds to, let's say I can't remember exactly. So I'm just going to write things out in a way that just as I remember them, and then I'll sort them out later. And up, down, and then actually to make it even more realistic, let's mix it up a little bit. Down, up, and then left, right, and then let's say we did like front, back, or even better, let's say we did like coronal and like caudal, right, which means head and foot. But I don't remember like how I organized these. Okay, so let's see. So frontal corresponding to left, right. That looks like a good alphabetical likelihood. But then there's down, up. I don't remember if it's down that goes with frontal, or left that goes with sagittal, or down that goes with sagittal, or gee, how do I remember? Well, just start trying to mix it up a little bit. Hopefully you do remember, but start trying to mix it up a little bit until it looks a little bit more correct, or until it jogs your memory. All right. And then transverse being coronal caudal. Hopefully you remember that it's not really dividing into head and foot or coronal caudal, because that is up, down. So you look for like inconsistencies. You look through the whole thing. All right, this looks okay. Sagittal being up, down can't be the same as transverse, because transverse is up, down. So
I thought coronal was frontal.
That's what
what's
I
that?
thought.
Coronal is frontal.
Yes. I'm saying I'm giving you an example of how you might list something incorrectly at first.
Oh,
Mm.
okay.
And I'm saying hopefully, like, this is how you would make a correction. This is just an example of someone listing it incorrectly and then correcting it. Like this is an example of, it's what it would look like if you didn't remember all the information, but you at least got the alphabetical concept, for example.
Got
right?
it.
Mm.
Okay, good. So you can troubleshoot this by seeing that up, down, for example, and coronal caudal, head and foot, those are the same thing. So one of these, either up, down, or coronal caudal, head and foot, one of those is not correct. Well, I think this one is correct because I remember listing up and down for sure, the same way that I remember listing left and right. So instead of coronal caudal, let me just get rid of that and start over. And let's see, how can I divide the body? Well, I can divide it into up, down. I've already got that. I can divide it into left, right. I've got that. There's one more way, and that's front, back. Like that. See, now I got to put this in order. Okay, F, S, T, those are in order. So this left column is good. Now, what about the right column? So we have left, right. Let's do left first. We have up, down. Let's do U first, just try it, and front, back. Well, let's see. So this may be out of order, right? Maybe it goes like that. Right, and then this wouldn't go there, right? Because we move from transverse to frontal from number 3 to number 1, and number 1 and number 2. So now the second one's got to go somewhere. So what I'm trying to show you is a person who's confused, doesn't remember all the information, but remembers some of it and works out the rest for himself. Hopefully that's of value to you. And then he goes back. You go back and you check, okay, frontal, sagittal, transverse, left column is in correct order. That's good. And front, back, left, right, up, down, that could be good. Oh, but G, letter D, down, that might be, that might go before letter L. And letter B for back, that might go someplace else. Well, let's see. What are the chances? Okay, so front and back, those are still in like the first part of the dictionary. So I'm going to leave the first part of the alphabet. So I'm going to leave those there. Now it's up to down versus left, or right versus down. And I think for the most part, left and right could be in second place. but I know for sure up would definitely be in third place. So I think the chances of mixing this one up are pretty slim. I'm going to leave that in third place and leave that one in second place. You guys got to, what I'm trying to show you is that if you get lost, if you forget something, if you can't reproduce it clearly, take the time to figure it out. Take the time to work it out. Use like your basic logic of, you know, ordering according to number or according to alphabet, or look for duplicates like I did with up down being a duplicate of coronal and caudal, or top and bottom, head and foot rather. Can I get some feedback on that? Was that confusing, clarifying? Was it helpful? Was it not helpful?
It was helpful.
It was helpful? Okay. Anyone else? I don't want any confusion on that. Our last class. Okay. Next. All right. So one more time, a client comes to you with difficulty bending forward toward the floor from the waist, and that is the sagittal plane. So the waist doesn't really apply. Like they could be bending forward through the lumbar spine flexion or thoracic spine flexion or whatever. It's all sagittal, going forward and back, even this. Chin to the chest, chin to the ceiling, it's sagittal. All right, let's see. A massage therapy practitioner is setting up a new wellness clinic and is working to do so in a manner that maintains HIPAA regulations for compliance. What is an example of a strategy that may lead to a breach in patient privacy? So what does HIPAA stand for? Marcos or Josh?
Well, HIPAA is a privacy for patients, or that mean that's just
Yes.
really the.
Yes, it is privacy. Yes, definitely. But it's a little tricky because the P in HIPAA isn't privacy, it's for portability, which is, it's kind of a vague, it's like, what does that have to do with privacy, you know?
No, yeah. Like I know that.
What about,
Oh, my bad. Go ahead.
what about the first two letters? What do the first two letters, the H and the I, stand for?
Health for sure, and then the I is, you know, I kind of forget the whole wording of the acronym. HIPAA.
That's all right. But if you get the first two, you can get the
I
concept.
know it's like, I don't know if it's like oh man.
It's information.
Okay, information.
Information, yeah, health information. If you remember Portability Accountability Act,
Right.
or Portability Act of America or whatever, you'll never get it. But if you can remember health information, you'll get it for sure. Health information.
Oh,
Or you can remember HIPAA is privacy. HIPAA is
sure.
privacy. And it's right here in the question. You got to learn to use, it will help if you can, if they give you something that gives you a clue to the meaning of the acronym, the meaning of the thing they're asking you about. In this case, they do. They mention privacy. So what's an example of a strategy that may lead to a breach in patient privacy? A breach, that means crossing a boundary, breaking a rule, breaking a law. A breach. Would it be a breach to keep paper files in a locked cabinet? Would that be not protecting somebody's health information? How about providing password protected computers and tablets, you know, to your staff? Would password protected computers and tablets be a breach in health information? What about keeping internet connections encrypted and your firewall protected? Would that be a breach?
No.
That's good. So no, no, and no. These all would be secure health information privacy protection protocols. What about setting up a mobile documentation station in the client lobby?
Yes.
That's right. And why would that be a breach of health information or patient privacy?
I would say because it's in a populated area, like there's other people in the lobby that can use.
That's exactly right. That's exactly right. And if someone is using a mobile documentation station in a public area, other people can just look over the person's shoulder, the patient's shoulder, and see that information.
Yeah.
Now, in real life, you actually see them doing this. Like if you go to I won't mention any names, but if you go to a popular primary care medical chain down the street here, there's like 2 or 3 now in the city. They have kiosks where they have where they have like a tablet, and you do everything right there on the tablet. You know, you enter your date of birth and your health information and everything on there. So that according to this is a breach of patient privacy. Yeah. Of the following options, which one does not require a physician referral? We had this one before. Is it a respiration rate of 15 breaths per minute? Is it a pulse over 90 beats per minute? A pulse below 60 beats per minute? Or is it warm, tender, and hard veins? Which one does not require a physician referral?
The respiration rate of 15 breaths per minute.
I think that's correct, yes. Yeah, does anyone have a question about that? During hot stone massage, what temperature should the stones be prior to application? And there's the answer right there. I guess I didn't. Yeah, that's fine. So it's 100 to 110 degrees. And the reason they give is because below 100 may not have the desired warming effect on the muscle tissue, but above 110 degrees may cause severe discomfort or a burn. A massage therapist who was not born in America has a supervisor who speaks very loudly and slowly only to her and does not delegate as much responsibility to her when compared to her peers for no defined reason. This supervisor is violating which ethical principle the most? Responsible caring, respect for the dignity of people, responsibility to society, integrity in relationships. Speaks loudly and slowly only to her and does not delegate as much responsibility to her compared to other people. Which one do you guys think it is?
Respect.
Respect for the dignity of
Two
people?
would be
Yeah, respect for the dignity of people.
Yeah. I guess you guys don't need like further reading into that, do you? Or we can if you want to, just let me know. When you are visually assess a client's gait, AMTA, unbelievable. Well, actually, I take it back. It's not like I've never misspelled anything before. When you visually assess a client's gait, what are you looking for? If their spine has proper curvature, if their body is symmetrical, if their walking pattern is smooth and balanced, if their muscles are restricting their movements. What do you guys think?
I would say
If their
3.
spine has, number 3, if their walking pattern is smooth and balanced.
Yes.
Okay. All right. Let's see. If their walking pattern is smooth and balanced. Yeah. Okay. When you visually assess a client's gait, you're looking to see if their walking pattern is smooth and balanced. You should look for 2 main factors: identify areas that move too much, identify areas that don't move enough. If you're assessing a client's posture, you're looking to see if their body is symmetrical. I think we should go through these. If you're assessing a client's basic body structure, you're looking to see if their spine has proper curvature. If you're assessing a client's restrictive range of motion, you're looking to see if their muscles are restricting their movements. So I'm going to ask you each one of these now, just don't look at the screen, okay? If you're assessing, if you're looking to see if a client's spine has proper curvature, what are you assessing? Client's posture, client's basic body structure, client's range of motion, or client's gait?
Posture.
Posture.
That's correct. And if you're looking to see if a client's muscle movements are restricting their movements, if a client's muscles are restricting their movements, what is it you're assessing? Are you assessing their gait? Are you assessing their posture? Are you assessing their basic body structure, or are you assessing restrictive range of motion?
Restricted range of motion.
Yes. And if you're looking to see if someone's body is symmetrical, are you looking at their posture, their structure, their range of motion, or their gait?
Structure.
Structure.
Okay, great, great, good. Fill in the blank. In blank massage, a therapist follows a set routine. This type of work is performed for general wellness, often in a spa setting.
Swedish.
In one more time.
Swedish.
All right, set routine. So Josh is voting for Swedish.
Yeah, Swedish.
Does anyone,
I
2
say
votes for Swedish? You say
Yes.
Swedish? 4 Swedish, okay. Dun, dun, dun. This is good. Remember, this is where you learn the most, right? By making mistakes. So why did you guys say Swedish? Josh?
Because it's a set routine. Is it?
You
All right,
know.
good. Yeah. And is Swedish also performed for general wellness?
I guess it'd be relaxation. If yeah, maybe relaxation.
You mean Swedish or protocol based?
Swedish would I guess if
Okay.
I think about it, maybe relaxation would be a better way to describe it. Swedish.
Okay. All right. Well, the reason they give for protocol based versus Swedish, okay, is superficial and Swedish massage techniques may or may not be part of protocol based massage. So what they're saying is that of the types of protocol based massage, there's Swedish is one type, and then sports massage is another, superficial is another, right? So this is a little bit tricky because they're asking you to pick the most correct answer, and in this case, that's the broadest answer, not the most specific answer.
And is the protocol based? I mean, is that because they say general wellness? Is that what indicates protocol based, or?
No, I think set routine indicates either superficial, protocol based, or Swedish. I just wanted to get your thinking on why. I wanted to find out a little bit more why you thought Swedish.
You know, I thought Swedish because of the spa. I feel like
Because of
them
the
putting,
spa.
yeah, them putting spa in there kind of threw me off because it's like you think of the spa, you think of like relaxation.
Yes, yes, yes. Okay, so you were focused on spa. I was focused on general wellness, and so I think those two are not focusing on those two words are not helpful. In this case, sometimes you have to focus on specific words, as we've seen. But in this case, it's picking the broadest answer. So and protocol based is a broad answer that includes superficial and Swedish.
Okay, that makes sense then.
Okay, good. Protocol-based massage, a therapist follows a set routine. That sounds like Swedish, right? This type of work is performed for general wellness, often in a spa setting. Protocol-based massage might include exfoliation, the application of pre-approval of essential oils and other relaxation techniques. That's not a very helpful description because it's, it may include, yeah, but it may not. I mean, there may be other things in there. The goal of these sessions is to give the client a particular kind of experience, not to address medical concerns. All right, if you say so. Broad rather than specific. During inspiration, oh, another thing. If you can discern that there are at least, that there's more than one correct answer, your thinking is probably not correct, right? So if I'm trying to be really specific to pick the one most correct answer by being really specific, hopefully I would recognize that Swedish and superficial massage are both types of set routines. And realize then, yes, no, I didn't know superficial was a set routine either. Well, now we know.
Mm-hmm.
Okay, during inspiration, which direction does the diaphragm move? What is inspiration, Charday?
I am guessing when you breathe. So
Yes.
so When I think of inspiration, I think it goes up.
The diaphragm goes up. Yes. But when you think of the breath, inspiring, which way is the breath going?
Down.
Yes. So which way is the diaphragm going?
Up.
Is that true? No, I don't think so. Down.
Oh.
During inspiration, the diaphragm moves down, functioning like a bellows.
Because I'm breathing and I'm thinking about my lungs versus the diaphragm. They go the opposite way.
All right. Fair enough. Fair enough. Okay. So they're okay. During inspiration, the diaphragm moves down, functioning as a bellows. This increases the volume of the pleural cavities. What are the pleural cavities? What's inside the pleural cavities?
The pleural cavities are like the things that receive the oxygen, isn't it? Or,
The pleura are the things that receive the oxygen. Those are the lungs. The cavities hold the pleura. The cavities are the spaces in the body that hold the lungs.
Gotcha.
Remember, cranial cavity, nasal
Yeah,
cavity, oral
yeah.
cavity, laryngeal cavity, thoracic
Cavity,
cavity.
like something in the middle, pretty much. Like cavities.
Well, yeah, I mean, cavity is like a space, right, or a hole,
Yeah.
right? So you have
Mhm.
pleural cavity, abdominal cavity, pelvic cavity, right?
Yeah.
Okay, so I'm just going to drill you guys in a couple other little pieces of information, just make up a couple questions for you. All right, so when inspiring, does lung pressure increase or does lung pressure decrease?
When inspiration does the lung pressure decrease or increase, right? You said?
Yeah,
It decreases.
it decreases. That's right. Is inspiration inhaling or exhaling?
Inhale.
Inhaling.
Inhaling. And when you inhale during inspiration, does the volume of the pleural cavity, does it increase or decrease? The volume?
Increase.
It increases, yes. Now, Josh.
Yep.
If the volume increases and the pressure decreases on inhalation, on inspiration, if the volume increases and the pressure decreases, what kind of relationship do volume and pressure have? Direct or inverse?
Inverse.
Inverse, that's correct. And which way does the diaphragm move, Josh, during inspiration? Up or down?
Down.
Down, very good. Okay, during exhalation, which way does the diaphragm move, Josh?
During inhalation.
Exhalation.
Oh, well, up then.
Up, yes. Marcos, what happens to the volume in the pleural cavity during exhalation? Does the volume increase or decrease during exhalation?
Decreases.
Yeah, and Larissa, during exhalation, the volume of the pleural cavity decreases. What happens to the pressure? Does it increase or decrease?
Decrease.
Exhalation, decrease in volume. What
Oh.
happens to the pressure?
So decrease in volume. Hold on.
Direct or inverse? I'm sorry. Yeah, direct relationship between volume and pressure, or inverse relationship between volume and pressure.
Inverse.
Inverse, yeah. So if exhalation causes a decrease in volume, what happens to the pressure?
Increase.
That's correct. You just got yourself another point on the MBLEx. Congratulations. Okay, so here's a visual, right? These are the lungs, okay? And as we're breathing in, the space, the volume increases, right? Now, what happens if you make the lung larger, what happens to the pressure when you make the lung larger? It decreases because there's more space. The space has to be filled. And what happens if you squeeze the air out? What happens to the pressure as you squeeze the walls of the lung toward each other? What happens to the pressure?
It increases.
Press your hands together. Yes, press your hands together like this. Everybody, can you feel an increase in pressure?
Yes.
No.
Larissa,
What?
press your hands like this. You feel the pressure of one hand against another?
Oh, yeah. Sorry.
Yes. Okay, now Larissa, go like this. Do you feel the pressure decreasing?
Yes.
Yes. Okay, so same thing with the lungs. The walls are moving away from each other. The volume is increasing, the pressure decreases. The lung is emptying, the walls of the lungs are moving towards each other. The volume decreases, the pressure increases.
So when
guys
you
remember
exhale, they decrease, correct?
they decrease what? Volume or pressure?
Oh, shit.
Go like this.
Okay.
Are you squeezing air out? Squeezing volume out?
Yes.
Yes. So does the volume decrease or increase?
I'm squeezing it decreases.
Yes. And what's happening to the pressure? The walls start to move towards each other. The lung walls move towards each other. They eliminate space. They're pressing against each other. And that does what to the pressure? Creates more or
Decreases.
less? Try again. Creates more pressure or less pressure?
It creates more.
It creates more. Yeah, yeah. Let's use something other than air. Okay. Let's say that it's like a bladder.
Okay.
Yeah, a bladder filled with, oh, I don't know, urine. So let's say that the bladder is emptying. So the bladder is squeezing, right? There's muscle inside the bladder. It's squeezing against the liquid. Can you see how squeezing against the liquid would increase the pressure? So much so
Yes.
that it forces the urine out, right? Okay. And can you see that once the bladder is empty, that there's very little pressure in there? It decreases the pressure. There's nothing pressing, there's no liquid pressing against the walls of the bladder, right?
Right.
Yeah, so that's a decrease in volume with urination, a decrease in volume and an increase in pressure. In fact, you could say an increase in pressure is necessary to decrease the volume, to squeeze out the urine or to squeeze out the air.
Gotcha. Okay.
Is that clearer?
Yes.
Great. During a session, a massage therapist places her client into a supine position and supports their left leg at the posterior ankle and posterior knee. Nice. Yes. She lifts both joints, bending the knee and applying pressure as she slowly pushes it toward the client's chest. This is an example of reciprocal inhibition stretching, proprioceptive muscular facilitation, active stretching, or passive stretching. What do you guys think?
Active stretching.
Well, why do you think it's active?
Because she's doing it.
Okay. In active stretching, who's doing the stretching? The person in the body, the client, or the therapist? No, wait, forget it. When you do active stretching, are you stretching yourself or someone else stretching you?
You're right. You're stretching yourself, so it's passive.
Passive.
Yes, I believe it's passive. Now, let's see what the answer is. Passive stretching, yes, passive stretching. Okay, so this is what I wanted to look at, is that one of these answers is actually really specific, reciprocal inhibition stretching, and one is really broad, which is active stretching. So reciprocal inhibition stretching is a type of active stretching. And I was hoping that PNF was not a type of passive stretching, because then we would have to figure out, do we want the more specific or the broader of the two answers? See what I mean?
Mhm.
So passive stretching occurs when a second person, such as a massage therapist, applies force to stretch you. In this example of passive stretching, the therapist is stretching your hamstrings. Active stretching occurs when a person stretches their own body, your body. Reciprocal inhibition stretching is when the antagonist muscle is being contracted against the muscle that is being stretched. Proprioceptive neuromuscular facilitation, PNF, is an assisted stretching technique in which a muscle is stretched into resistance 3 to 4 times, facilitating the nervous system. So it sounds like PNF may be a type of passive stretching. So, so let's just agree, just for the sake of argument, just so we can navigate the test taking skill. Let's just say that PNF is a type of passive stretching, and reciprocal inhibition stretching is a type of active stretching. So we're going to eliminate number 1 and 3. All right, number 1 and 3. Now we have to decide which is the correct answer, number 2 or number 4. During a session, so you always go back to the question. During a session, a massage therapist places her client into a supine position and supports their left leg at the posterior ankle and posterior knee. She lifts both joints, bending the knee and applying pressure as she slowly pushes it towards the client's chest. This is an example of proprioceptive neuromuscular facilitation or passive stretching. Yeah. So I would definitely choose passive stretching. And the reason is because there's not enough description to indicate the repeated, the stretching 3 or 4 times to the end point of a muscle's range, which is PNF. So since that's not included, that level of detail is not there, I wouldn't pick the more specific answer. I would pick the broader one. Any questions about that? Okay. Ooh, yes. So in efferent and afferent, where do the signals go? Do they arrive in the central nervous system, or do they exit the central nervous system?
Which one did you say?
I said both.
Oh, well, the efferent exits and the efferent arrives.
Arrives, nice. If a client is unable to feel your touch on a certain area of the leg, what type of nerves are most likely affected? The efferent nerves, the afferent nerves, the cranial nerves, or the radial nerves? What do you think, Josh?
The afferent.
Yes, afferent with letter A. Okay, fill in the blanks. If a massage is applied directly over the medial condyle of the humerus, the massage therapist risks damage or irritating the ulnar nerve, ulnar artery, and radial artery. All right, let's just take these one by one, because you're gonna have to break each one down. This is like a lot of detail in each answer, so let's break each one down, okay? So everybody touch the medial epicondyle of your humerus. I'm not gonna show you where it is. Touch the medial epicondyle of the humerus. Is there an ulnar nerve there? Okay, time to touch, time to show. Medial epicondyle of the humerus. Please tell me if I've got the wrong surface. Medial epicondyle of the humerus. Is there an ulnar side?
Oh, yeah.
Yes. Is there a radial side there? No.
No.
So it can't be number 1, right? Okay, Larissa, you take the next one. Touch the lateral epicondyle of the humerus. Is there a vagus nerve there?
Lateral epicondyle of the humerus. No.
Vagus nerve is very good. What kind of nerve is the vagus nerve?
Vagus nerve.
Does it originate in the central nervous system or the peripheral nervous system?
The peripheral. Peripheral.
It goes through the peripheral. It's the longest peripheral nerve in the body, but it originates in the central nervous system. It's also known as a what type of nerve? Same word for head or skull.
Central.
What type of nerve? Cranial nerve.
Oh.
It's one of the 12 cranial nerves. So there's no cranial nerve on the lateral epicondyle or anywhere on the arm. Marcos.
Yeah.
If massage is applied directly over the sciatic nerve, the massage therapist risks damaging or irritating the posterior knee. So this is a little tricky. It's a little tricky.
The sciatic nerve, it does. I mean, the posterior part of the knee is the back side of the knee, right? So I mean,
That's right.
If you massage it, you got to be careful because it might hurt, you know.
Yeah, or more importantly, the posterior knee contains the sciatic nerve.
Yeah.
In these other ones, there are structures which were not in the locations. There were nerves not in the locations. In this one, the nerve is in the location.
Yeah.
But they reversed the order. You see that? They started here. They started with the location, the name of the bone. And here they start with the nerve. They start with the name of the bone and then you give the nerve. They give the name of the bone and then give the nerve. Here they give you the nerve. Then they give you the location, not even the bone. They give you a location. So they flipped it.
Oh,
It's not good, but this is the most correct answer.
Yeah, that's what I was. I was like, okay, that's the correct one. But now that you put it,
Yes,
I was like, oh,
but
man.
it's wonky. It's like they mixed it up, right?
Yeah.
Josh, now you get the shittiest question, Josh. Unfortunately, this is the shittiest question, but you got it.
Thank you.
The anterior triangle. Where's the anterior triangle?
And the neck.
Josh, way to handle it, man. You handled it. And the umbilicus,
The
the
belly
umbilicus is
button.
nowhere near the neck, is it?
Yeah. So negative
that's not the
number
answer.
4. Yeah.
Negative on number 4. That's right. Okay, how come I cannot advance? Is this it? Is this all the questions I have loaded? No, it's not. I don't think that's all. Why won't it let me advance? Okay, let me get back to the, sorry, I had a little keystroke malfunction. Yeah, medial epicondyle. Oh, wait.
That's the wrong one.
No, this should not be correct. If the massage is applied directly over the blank, the massage therapist risks damaging or irritating the medial epicondyle of the humerus, ulnar nerve, ulnar artery, radial artery. There's no radial artery on the medial epicondyle of the humerus. They're saying this is correct.
Wow.
Well, I'm sorry that I gave you incorrect information. Let's take a look at it and figure out why. This is how we learn. I'm learning too. If a massage is applied directly over the medial epicondyle of the humerus, the massage therapist risks damage or irritating the ulnar nerve, ulnar artery, and radial artery. Massaging directly over the lateral epicondyle of the humerus endangers the radial nerve, not the vagus nerve. While massage over the sciatic notch is contraindicated, it is appropriate to massage over certain areas innervated by the sciatic nerve. Sciatic nerve does not innervate the posterior knee. The umbilicus and the anterior triangle are two different endangerment sites and do not fit together above the sentence. Okay, we have to look at that.
Yeah, it looks like the ulnar nerve passes right over the medial epicondyle. Yeah.
The ulnar nerve does, but it's the radial artery that's confusing to me.
Okay.
Let's see. Radial artery. You see, yeah, ulnar nerve. I got it because that's on the ulnar side or the medial side of the epicondyle. Ulnar artery, that makes sense, but radial artery, let's see, maybe they're right next to each other. Let's see, medial, epicondyle, and let's try arteries. Man, I hate making mistakes like that, but it happens. Let's see. Where's a clear one? Let's try this one. No, that's not clear enough. Okay, medial epicondyle, ulnar artery, radial artery. I don't understand.
I don't know.
Josh, did you say, did I hear somebody said yeah when I opened this up? Did you say yeah?
Yeah, what? I mean, I'm looking at a picture that, I mean, it's similar. I mean, they pass so closely that, yeah.
Okay, guys, look. Here's a nice hand of a massage therapist or chiropractor drawn for reference. It's above the elbow. The space just above the on the upper arm on the humerus is where you find the epicondyles, the medial and lateral epicondyles. All right. On the medial side, you have the ulnar nerve. You have the ulnar nerve, and then you have the ulnar artery. But this artery is called the brachial artery, and it splits into the ulnar artery on the medial side and the radial artery closer to the lateral epicondyle. Let me read it one more time. The medial epicondyle of the humerus. Medial epicondyle of the humerus. Yeah. Medial epicondyle of the humerus. Ulnar nerve, ulnar artery, and radial artery. If massage is applied directly over the medial epicondyle of the humerus, the massage therapist risks damage or irritating the ulnar nerve, ulnar artery, and radial artery. I do not agree with that.
Yeah, I thought it was 3, but
You thought it was the sciatic nerve and the posterior knee, correct?
yes, that's what it
Okay.
made the most sense. But
Okay. Well, I can see why that would be incorrect now, because the sciatic nerve is named down here is being named the common peroneal nerve, and then the tibial nerve, the peroneal nerve, and the deep peroneal nerve. So it's the peroneal and the tibial nerve, which are behind the knee. Yeah, it's the peroneal nerve and the sciatic nerve up at the top. Now, I thought it was sciatic all the way down because that's what they call it. And in some drawings, look, they'll just draw the whole thing and they'll label it the sciatic nerve at the top. So yeah, I'm like definitely learning this. That's great. Look here, they've got the sciatic. Say again?
Where's the continuity?
That's a good question. It depends on who you ask. Like the body systems, are there 11, are there 12, are there 14?
Right.
So here they're calling the peroneal nerve area the sciatic nerve. Whereas no, this is sensory innervation. So let's not depend on that too much. Is anyone else upset about this?
Yes.
Yeah, I know I am.
Kind of weird, yeah.
Well, this is pretty clear. Medial spherical cutaneous nerve. This is the small branch here. This looks like the tibial nerve. Common peroneal nerve. Peroneal anastomotic. An anastomosis is a split off of a main branch. Yeah, that sucks. That's a shitty question. So if you see this answer listed among the answers, and the question is regarding the medial epicondyle, then is the risk of damaging or irritating the ulnar nerve, the ulnar artery, the radial artery, then choose that answer. Hey, at least it's not the umbilicus and the triangular fossa, you know what I mean? That sucks. Let's do a couple more and then take a break, or do you guys want to take a break now?
Break.
Did you say break?
I would say break. I don't know.
All right.
Ready.
All right. All right. Break. Take a break. Come back in 10 minutes. That is at 7:17 EST. All right. I'll see you guys in a little bit.
Okay.
Sorry, guys. I'm just paranoid that I'm not recording, so I just want to make sure I'm recording. Yes. This is one of my favorite questions here. We'll go over that in a minute. Yeah. I'm going to write to them. I'm going to email them about this question. Seriously. Is everybody with me?
Yes.
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 Nice. Okay, onward. A massage therapist has recently begun a new advertising campaign for his business. Remember, like business development professionalism is going to be part of the exam. It emphasizes that he can cure arthritis. What is a potential issue with this type of advertising? Potential to be mistaken for medical treatment, potential to bring in more clients with arthritis. Massage therapists should not promote themselves, potential to be considered medical malpractice. All right. Oh boy. Which two answers could it possibly be?
Potential to be mistaken for medical treatment.
Could be that one. Which other one has a high chance?
Medical
Clients with
malpractice.
arthritis.
Medical malpractice. Medical malpractice. The one with arthritis, this is like a, I don't really know what to call it, but the potential to bring in more clients with arthritis. What they're asking about is a problem. This would not really be a problem for the massage therapist. You know what I mean?
Sorry, I misread that. I'm sorry about that.
That's all right, but you understand why it's not correct?
Absolutely, yes.
All right. And then massage therapists should not promote themselves. Also, that is not correct for different reasons, but okay. So let's see. Okay. So let's take it one by one. It's number 1 or number 4, A or D. Let's do number 4 first. Potential to be considered medical malpractice. What is medical malpractice?
when you technically like do a procedure and then it something goes wrong for not taking the proper measurements, right?
Yes, when you do harm because you didn't take the correct precautions
Yeah.
or because you intended to do harm.
Mm.
Now that's not a complete definition, but this doesn't sound like, if we use that definition, Marcos, this doesn't sound like medical malpractice, right?
Right.
Also, medical malpractice happens. Medical malpractice happens in the context of what? Advertising or massage practice.
Yeah, massage practice.
Yeah, and this describes advertising. So potential to be mistaken for medical treatment. Can you see how that would be the more appropriate of the two?
Yeah.
Because it happens this is happening in the process of someone reading an advertisement and thinking about it, rather than in the process of a clinical massage treatment.
Mm.
Let's see if that's correct. Hell, I missed the last one. Let's see if potential to be mistaken for medical treatment. Yeah. Now, they don't explain it very well. They just say medical treatment is outside a massage therapist's scope of practice. The therapist should not claim the ability to cure a medical condition. And those are, to me, are two different statements. This is really the heart of the problem. Therapists should not claim the ability to cure a specific thing. I mean, mainly because arthritis cannot be cured. And massage therapists, as much as I love you, cannot cure arthritis. Neither can acupuncturists. Once you have arthritis, you have it. Perhaps it can be slowed down, but it can't be cured. Cure is false advertising. And the problem here is not the practice of medicine. It's not the practice of massage. It's the advertising. Any questions about that? Let me know, okay? What is the process of energy loss caused by friction when tissues are loaded and unloaded? What is the process of energy loss caused by friction when tissues are loaded and unloaded? Loaded and unloaded, or loaded and unloaded, loaded and unloaded. Energy loss. Which one is it, do you guys think? Yeah, that's what I did. The answer is hysteresis. Hysteresis. Hysteresis is the process of energy loss caused by friction when tissues are loaded and unloaded. The tissues produce heat as they are loaded and unloaded, which happens with on and off pressure. On and off pressure. Think of like kneading, cross fiber friction, those kinds of things. Creating hysteresis reduces stiffness and improves tissue extensibility. Do you guys have a good picture in your mind of what hysteresis looks like?
Yes.
Okay, great. You guys let me know if you need clarification. Creep. Creep is the continued deformation of a viscoelastic material under constant load. So viscoelastic is like, there are structures in the body that are viscoelastic, which is what this question is doing here. Muscles, tendons, ligaments, right? So what creep is if you traction a joint, over time, the joint starts to become looser. The tendons start to become longer. That's creep.
Mm.
I found a nice, where's this thing I found? What's that? No, not that one. No, not this one. Look at this. I have no friends. Dave Chappelle. This is aha, creep. Okay. They illustrate creep by showing a rubber band next to a measuring stick, and there's a 1 kilogram weight tied to this rubber band, and over time, I'm sorry, guys. Yeah, I didn't pay my YouTube premium this month, so it's asking me to pay for a trial. Types of where? Where's creep? There it is. And over time, it will lengthen the rubber band, and that's called creep. Turns out, yeah, a creep is the continued deformation of viscoelastic material under constant load. So tractioning the neck in looking for that release, looking for the decompression of the spine, you're looking for the creep of the tendons. You're lengthening the tendons. If they stay lengthened, that's called plastic or plasticity. But that's not here among the questions. All right, and then the last one, thixotropy or thixotropy. Thixotropy is a quality of colloids. Colloids are a type of like semi-liquid substance in which rapid force increases the rigidity of the tissue. Rapid force increases the rigidity of the tissue. I don't know what that looks like. Do you guys want to see it? No, you know what? Forget it. No. Let's move on. Fill in the blank. If a client has been diagnosed with a thrombosis, they will likely present with involuntary muscle twitches and decreased dopamine level. If they have been diagnosed with tremors, they'll likely present with involuntary muscle twitches, sciatica or neuropathy. Which one?
I say sciatica.
Okay. They will likely present with involuntary muscle twitches and decreased dopamine levels.
Tremors.
Tremors, yeah.
Hmm.
Tremors. Tremors are a condition of involuntary muscle twitches. They're also associated with low levels of dopamine, such as in the neurologic condition Parkinson's. Massage has been known to increase dopamine activity, therefore massage is indicated in the management of tremors. A thrombosis is a blood clot in either the blood vessels or the heart. Sciatica is inflammation of the sciatic nerve. Neuropathy is nerve pain. So no muscle twitching there. Which of the following is not a function of the endocrine system? Regulates the metabolic process, produces neurotransmitters, produces hormones, maintains homeostasis. Which one is not?
Produces neurotransmitters.
That's correct. Which system produces neurotransmitters?
I would say the peripheral system.
The peripheral system is not among the choices listed.
I mean the nervous system, you know.
The nervous system. Yeah, I'm sorry. It's not that it's not listed. It's a division of the broader system name, which is nervous system. Yes.
Yeah.
During an initial appointment with a new client, a massage therapist performs a gait assessment. Aha. What are you looking for when you look for a gait assessment? Are you looking for the general alignment of the spine? Are you looking for range of motion restrictions? Are you looking for symmetry of movement, or are you looking for there's one I'm missing. Range of motion, symmetry between left and right, contour of the spine. Let's just say the other one is I don't know, mobility. Gait assessment. What are you looking for? Let's go back to that one.
Movement.
Movement, yeah.
Yes.
Movement.
Yes, definitely. But let's be more specific as possible. When you assess a person's gait, you're looking for, I think it's restricted movements or movement. Yes. Oh, no. If the walking pattern is balanced, that's the one I'm missing. Okay, so assessing a client's gait. Where's gait? Assessing a client's gait, you're looking to see if their pattern is smooth and balanced. Yeah, to see if the pattern is smooth and balanced. Gait is smooth and balanced. And then posture is symmetry. Body structure is spine curvature. And then range of motion is restriction in movement. Range of motion is restriction in movement. So if you're looking at gait, here's that Condal question again. So if you're looking at gait, you're looking for one more time, restrictions in the range of movement. Let's say smooth movement.
Smooth and balanced movement.
Smooth and balanced movement. Symmetry or spine alignment. Smooth and balanced
Symmetry.
movement.
Right?
Not symmetry.
Oh no, you said
Yeah, not symmetry here. Let's go back. Okay. It does pay to repeat things. Okay. I'm losing my mind now. Okay. Spine has spine alignment. That is basic body structure. Spine alignment is basic body structure. Symmetry is posture. Symmetry is posture. Proper curvature of the spine, spine alignment. Symmetry is posture. Walking pattern is smooth or balanced. That's gait. Muscles restricted or allowing movement. That's range of motion. Okay, performing a gait assessment. This assessment is least likely to reveal which of the following: trigger points in the piriformis, torn meniscus of the knee, contracture of the rectus femoris, trigger points in the sternocleidomastoid. The answer is trigger points in the sternocleidomastoid because it's in the wrong part of the body. It's in the neck. Piriformis, knee, rectus femoris, those are all, those are, piriformis is in the glutes, deep to the glutes, the knee is in the leg, and the rectus femoris is in the leg. The reaction that happens within cellular processes that's responsible for the production or consumption of energy is known as circulation, absorption, metabolism, or reproduction. The consumption of energy or the production of energy. Is that circulation, absorption, metabolism, or reproduction?
I want to say metabolism.
Very good. Anyone confused about that?
No.
During the licensing process, some states will require a massage therapist to pass this type of exam, which ensures the massage therapist understands the laws regulating their profession. This seems familiar. Which one is that? The laws regulating their profession. Is that jurisprudence, state board exam, exempt from examination, or constitutional examination?
I think it was
Yeah.
jurisprudence.
Jurisprudence, that's right, jurisprudence, correct. What are a number of ways to classify various types of blood pressure? There are a number of ways to classify various types of blood pressure. What is diastolic pressure? Diastolic pressure.
Yeah.
Is that the pressure of the blood within the ventricle, the pressure of the blood against the walls of the arteries when the ventricles contract, the pressure of blood against the walls of the arteries when the ventricles relax, or the pressure of blood within the atrium?
I would say when the ventricles relax. Blood of
I would say
pressure.
so. Would say so too. Pressure of blood against the walls of the arteries when the ventricles relax. Yes. So the number on top is systolic. The number on the bottom is diastolic. For example, 80 over 100. I like this mnemonic down here. Systolic, S is for squeeze, D is for downtime.
Mhm.
Another way that you can remember it is maybe you can visualize the heart contracting. The heart contracts on the top number. They call it lub-dub, lub-dub. The heart contracts on the top number and relaxes on the bottom number. Lub-dub, lub-dub. But with 4 chambers, there's no strict relaxing and contracting. It's actually the heart. It looks like top, bottom, like top, bottom, top, bottom. It kind of moves in this spiraling way. It makes the whole organ move like that. Okay, anyhow. Anna and Betty are 2 massage therapists working in the same clinic. Last week, Anna overheard Betty instruct 2 of her clients to perform self-manipulation of the thoracic spine between sessions. What is the first action, if any, Anna should take? Self-manipulation of the thoracic spine. That could be as simple as, why don't you try laying on a foam roller? What, if any, action should Anna take? Inform Betty she is working outside of the scope of practice. Report Betty to the state board. That's a little extreme. Ask that Betty be fired, also extreme. No action needed. This is within the scope of practice.
I would say no action needed since it's self.
Since what?
Since it's self manipulation.
Oh, I see. I see. The problem is not that the client is doing it to themselves. The problem is that it's the massage therapist telling the client to do it to themselves.
So it's the first one.
Yes, correct. Inform Betty she's working outside of the scope of practice. Yeah. Go up to your colleague and tell them they're doing something illegal. See what kind of reaction you get. That's a no-win situation. There's no way to win with that. I mean, if you're really concerned, if you think someone is just, reckless and not very good, then I guess you have to say something. But it's difficult situation, but not unhandleable. Okay, what might be a reason a person currently hospitalized with breast cancer is referred for massage? Why would they refer a breast cancer patient for massage? To improve muscle activation of the pectorals, to improve soft tissue mobility in the pectorals, to reduce nausea. This person is not a candidate for massage. What do you guys think? What do you guys think?
Not a candidate?
Well, that's not bad thinking.
I say improve soft tissue mobility.
Also not bad thinking, but I would say, first of all, it is a situation that should prompt you to ask the question, is this person a candidate for massage? I'll bet it's nausea. Let's see. Yes, reduces nausea. And I'm not just saying that because I'm the one who assembled the slides. So let's find out why this is correct. It's likely this person is experiencing nausea as a result of the treatment for cancer. Massage can be very effective in reducing nausea. and anti-emetic, that means anti-vomiting. An anti-emetic drug use can subsequently reduce nausea further. And just a little side note there. This client would be appropriate for massage because since they have been referred by another medical professional while in the hospital, the massage therapist must take care not to apply heat to this patient as this can encourage the spread of cancerous tissue. I didn't know that. Direct massage of the treatment area, which includes the chest for breast cancer patients, is contraindicated. Do not massage the area where there is cancer, the chest, including the pectorals. Contraindicated. I guess they think you could spread cancer. I guess it's possible or not, but let's not find out, right? Just stay away from it. But hey, you can reduce nausea. That's like a major thing. And another major thing is that having someone provide care for you, having someone's hands on you is an extremely soothing and I would say mentally, emotionally healing, maybe energetically healing experience to have. And cancer is extremely, extremely frightening, you know? Some comfort in your body could be very valuable at that time, not just to reduce nausea, but. Okay, oxygen in the human body is an example of which of the following? Is oxygen an organelle, an atom, a molecule, or a cell?
Oxygen is it's an atom.
Okay, it's either atom or molecule. Well, let's find out. It's a molecule.
Okay.
Oxygen is an example of a molecule. A molecule is a group of atoms bound together to perform a function. Oxygen, this is tricky. Oxygen is a chemical element that occurs in the air as a gas comprised of 2 oxygen atoms. So oxygen in the air is oxygen in the air is 2 atoms together. Oxygen in the body is 2 atoms together. And that's in both cases called a molecule. So oxygen always occurs. I'm not explaining this very clearly. What else is new? Oxygen occurs as 2 atoms together.
Mm-hmm.
A molecule of 2 oxygen atoms. A molecule of 2 oxygen atoms. Okay, at the end of the day, a massage therapist is cleaning his treatment room. What is the best order in which to clean the area? Cleanest area first, cleaning away from the body. Dirtiest area first, cleaning away from the body. Dirtiest area first, cleaning toward the body. Cleanest area first, cleaning toward the body. Sounds to me like, go ahead.
No, I'm trying to think. Like I think it's one of the I would say the cleanest area first.
Yes.
But
And
like the second part is throwing me away, throwing me off because what do they like cleaning away from the body? Oh, okay, I get it. Cleaning away. Yeah, I get it now. I had to read it a couple of times.
always a good idea, Sade, to read it a couple times. Why the cleanest area first?
Because you want to get the least dirt, so at the end you get the dirtiest part and you can just get rid of all of it. Spread
That's
the
right.
germs.
That's right. Spread germs the least. Spread contamination the least. That's right. Absolutely right. Okay. A client reports pain. Larisa, this one is for you. A client reports pain in her neck when she looks up at the sky. Which movement term describes this motion? Is that neck flexion or neck extension?
Can you repeat that question again? I can't see the question. It's like way too small.
A client
on my
reports,
phone.
oh, on your phone, okay. A client reports pain in her neck when she looks up at the sky. Is that neck flexion or neck extension?
Okay, this is extension.
That's right. And during neck extension,
Okay, good.
and during neck extension, are the neck extensors firing eccentrically or concentrically?
Extension. They are concentric is when they come together. So eccentric.
Concentric, con, with.
Concentric. Am I right?
Oh, I'm sorry. I didn't realize you were correcting the answer. Yes. Yes, it's concentric. Yes. And in neck extension, the flexors would be firing which way? Eccentric or concentric?
Flexors. Extension. Hold on. The flexing. They are concentric. Eccentric. Or wait, concentric and what's the other one again? Eccentric, right?
Flexors and extensors, eccentric and concentric. Yes.
So eccentric.
Eccentric for the flexors. Yes.
Mhm.
Good. Which of the following muscles are all agonists or synergists in hip extension? Ooh, we didn't cover this in depth. Okay, so let's see how you guys do. All right, rectus, which ones are all agonists or synergists in hip extension? First of all, visualize hip extension in your mind. Hip extension. Rectus femoris, gluteus medius, gluteus maximus. We're looking for all agonists or all synergists.
In the hip.
Gluteus minimus, psoas, adductor magnus. Gluteus minimus, psoas, adductor magnus. Gluteus maximus, semimembranosus, biceps femoris. Gluteus maximus, semimembranosus, biceps femoris.
I think it's that one. the
Yeah.
gluteus
I
maximus.
think
I think so too.
so too, yes. Tensor fascia lata, adductor magnus, psoas. Yes. It's the glute max, semimembranosus, and the biceps femoris. Now, how do you know it's not I would like to know how you know it's not the other three. This answer is unique because it's the only answer of its kind. How? Tell me how it's the only answer of its kind.
Mm. Well, agonist is pretty much like a muscle that does the main action, and then synergist is a muscle that relaxes.
That's synergist doesn't relax. The antagonist relaxes. The synergist does what?
Flexing.
It helps. It
help.
assists.
Mhm.
Yeah. Yeah. It does like similar movement. And all of these muscles, they're all on the same surface of the body. They're all on the back surface of the body,
Mhm.
right? These are on different surfaces. Each of these other three answers has muscles that are on different surfaces. TFL is on the outside, adductor mag is on the inside. Any questions, guys? You guys want to look at agonists, synergists, and antagonists? You want to look at a summary of those?
Sure.
the sciatic nerve drawing. I'm still mad about that. List of agonists and synergists. Typing nothing. Okay. Let's try this one. Oh. No. All right. What beautiful posture. We don't have a list. List of. I do say list of. All right. Examples, plural. Okay, for example, the iliacus, psoas major, and rectus femoris all act to flex the hip joint. So the rectus femoris muscle is on the front surface of the body, and it's at the hip. The psoas muscle is on the front surface of the body in the abdomen and attaches to the leg. It crosses the hip joint. The iliacus muscle is also on the front surface of the body and it crosses the hip joint. Let's see. Okay. Try one more time. Okay. Well, let's just shop around just a little bit. Okay. So here, the biceps and triceps are the agonist antagonist. The synergist for the biceps would be the brachialis muscle, the brachialis muscle or the brachioradialis muscle. The synergist for the triceps would be the latissimus dorsi muscle in the back. Here you have the, oh, this is the same. This is just from the side. Okay, everybody loves to show the biceps and the triceps. Let's see what this is. Easy, no cards. Okay, so the latissimus dorsi, they're showing that the latissimus dorsi does extension here, going behind the back. Other muscles that would synergistically help in extension could be the tricep muscle, also the posterior deltoid muscle. Let's see if there's anything else that might be useful. I'm sorry, I thought I had a list of those for you guys. And let's see, the back muscle, trapezius. Well, there's 3 trapezius muscles. So the middle trapezius would work synergistically with the rhomboid muscles, and the infraspinatus may be a synergist for the trapezius, for the middle trapezius. Also the rhomboid major, yeah. Okay, infraspinatus, prime mover for external rotation. The teres muscle would also be a synergist for the infraspinatus muscle. Let's see, what else? Let's see, external abdominal oblique for bringing the left shoulder to the right hip. If that's the agonist, then the synergist would be part of the rectus abdominis muscle and maybe part of the right transverse abdominis muscle. Okay, is that enough for you guys? I hope so. Speak up. Yes, no?
Yes.
Okay. Right. When assessing a client for range of motion, the client therapist, the massage therapist notices the client has 5 degrees of hip extension. Is that a lot or not very much?
That's not a lot.
Yeah, not a lot. What would be an appropriate intervention to improve this? Contract and relax the glute max, then contract the psoas while moving the client in the hip flexion. Contract and relax the glute max, then contract the psoas while moving the client into hip extension. Contract and relax the psoas, then contract the glute max while moving the client into hip flexion. Contract and relax the psoas, and contract the glute max while moving the client into hip extension. Okay, speak up if you're totally confused. You have no idea how to navigate this question.
Can you move it back up so I can read the question again, please?
Yes. There we go. When assessing a client for range of motion, the massage therapist notices the client has 5 degrees of hip extension. What would be an appropriate intervention to improve this? Is anyone totally confused? No idea where to start?
I think I'm starting with the flexion because since it says extension, I'm thinking about the
Okay. Yes, that is good thinking. That is good thinking to start with the flexion. But I would start even broader than that. I would look at how the answers are constructed. They all have the same pattern. So this is contract the glutes, contract the psoas, or contract the psoas, contract the glutes, right?
Mhm.
So if you want to work hip extension, if you want to improve hip extension, that involves contraction of the psoas or the glutes.
psoas.
The contraction, the hip extension is not the psoas, it's glute.
Oh, okay.
Hip flexion is the psoas.
Oh, yeah.
So hip extension is the glute. So you want the glute to come second and the psoas to come first. So it's going to be it's going to say contract and relax the psoas. It's going to be one of these last two, not one of these first two. I think. Is that right?
Yeah.
Where's the damn answer?
Number 3.
Yes. So contract and relax the psoas. And then you have to decide, is it while moving the client into hip flexion or while moving the client into hip extension? And hopefully it's obvious to you that it's hip extension. Let's see. I think there's a name for this. Yeah, the contract, relax, agonist, contract muscle energy technique. Contract, relax, agonist, contract. Using the muscle energy technique. Contract, relax, agonist, contract, muscle energy technique. This is performed by first having the client contract the targeted muscle, the psoas, then relax, followed by the contraction of the antagonist, the glute max, while stretching the target tissue. Yes. Yeah. Did I reverse that? No, I didn't reverse that. It's contract and relax the psoas, then contract the glute max. Yeah, that's correct. Yeah. Okay. Okay, guys. It has been a pleasure. If you want to retake the class, please reach out to me and I'll reach out to Varsity and I'll see if I can get it scheduled. Larissa did that and the communication was not clear the first time, but I think I've got it clear now. But they just by chance ended up offering another MBLEx class. And so Larissa was able to take that one. And if you want one-on-ones, you can reach out to Varsity or to me, right? So if you want another class, reach out to me. If you want one-on-ones, reach out to Varsity or to me.
Okay.
And I'll be
So-
adding, go ahead.
Oh, I'm sorry. Yeah, I was gonna ask, so if we want to take the class again, we can reach out to you or,
Yeah. Yeah, and I'll contact Varsity,
okay,
right? And I'll also be adding on the Compassionate Learning YouTube page. I'll also be adding more videos
Mhm.
to that and more study materials and the MBLEx folder on Google Drive. I've been working on that for like 3 classes now. This is the 3rd class. So some of the materials are either redundant or some of the materials have, so some of the information is split across multiple documents. So for example, I might have kinesiology study notes in like 2 documents, right? I might have anatomy and physiology notes among like 3 documents. So I do need to clean that up. I need to consolidate those things to make it easier for you guys to access the information. But I do hope that you'll like go there and use the slides and use the study guides. You know, if nothing else, you can get access to like stuff from like AMTA app and the Yugo Prep app there. And I have some videos that I've made and in there, and more stuff will be added. Okay, guys, it's been a pleasure. If you take the test, please let me know how you did. If you like what I provided, please give me a review through Varsity.
thank you.
Okay,
Thanks for your help, Kim.
you're welcome. It's been a real pleasure. You guys have a great night. Good luck on your exams. Maybe I'll see you next time.
Yeah.
Right on. Thank you, Kim.
All right, take it easy.